As Amy mentioned, there are many modifications in the guide that we can ensure that our users are exercising safely during pregnancy. Exercising during pregnancy does not mean that it is easy. During the first trimester, we place a large emphasis on strengthening our core muscles. At E&E, we think about our core muscles being our abdominals, our back muscles, our diaphragm, our pelvic floor. Some of these modifications include cutting out exercises as pregnancy progresses, such as planking, crunches, jumping, asymmetrical movement, supine exercises, bridging, excessive intra-abdominal pressure with load. More importantly than what we cut out of the guide is actually what is in the guide. We wrote this guide to prehab injuries, just like they do in the NFL or other professional sports. We're trying to prevent, combat, reduce common aches and pains during pregnancy. Impairments that mamas face during pregnancy are predictable. Considerations for the guide include headache, neck aches, mid-back pain, low back pain, carpal tunnel, sciatica, SI, pubic bone pain, urinary stress incontinence, low back pain, diastasis rectus, round ligament pain, and calf cramps. It would be egotistical to truly believe that we can prevent this in all of our users, but we are committed to providing the best kind of preventative care that we can. Not only are we concerned with a woman reaping the benefits of exercise during pregnancy so that they have a comfortable pregnancy so that they can quickly return to their postpartum selves, but let's face it, being a mama is hard work, so this guide is also sport specific. Sport specific meaning that we are training a mom to be the best kind of mama that they can be. There is a lot of physical demand on a female, including carrying a baby during the gestational period, labor and delivery, recovery, nursing, caring for an infant, and carrying around all their stuff. For example, in the guide, there is exercises to reduce mid-back pain soreness from carrying and nursing a baby, such as mid-trapezius strengthening, rhomboid strengthening, external rotation of the rotator cuff. So in hopes that we're reducing that mid-back pain soreness. That's just one of the many examples of the physical demands that we have trained ourselves for in the guide. Both Amy and I had extreme back pain nursing during our first children and none during the second. The difference was we both tested and used the guide during our second pregnancies. One of the most important sections is the pelvic floor section of the guide. Women are cued in onto what the levator ani is. We have them in certain positions to make it easier or harder. They are taught to control the variation of their contractions of the levator ani just like any other muscle. It shouldn't be an all or nothing task. They're taught not to compensate with abdominals, butt muscles, adductors. There are long rest periods to ensure that patients are actually relaxing their pelvic floor, because we all know that contracting is just as important as the relaxation. Towards the end of the guide, we're also teaching them what actually the bulging feeling feels like. And then we cue them in that that's not a normal thing that they should be practicing, but just to prep for labor and delivery.